If you've ever dealt with chronic low back pain, you know it's more than just an ache, right? It can completely take over your life. Millions of people are going through this every single day, and one of the most common things doctors offer is a steroid injection right into the spine. But here's the billion-dollar question. Does it actually work? Well, we're going to dig into the highest level of scientific evidence there is to find out. So, here's how we're going to break it all down. First, we'll talk about the problem itself. Then we'll get into the procedure, the epidural steroid injection. We're going to zoom in on one specific technique called the Caudal approach, and then, this is the good part, we'll see what a major scientific review found. And finally, we'll answer that big question. Is it truly effective? Okay, first things first, let's just set the stage. We're not talking about the kind of backache you get after, helping a friend move. We're talking about that chronic, nagging, persistent low back pain, the kind that just grinds you down and stops you from doing the things you love. It's an incredibly common problem, and frankly, it's just exhausting for people who live with it. And all of that pain leads to this one really crucial question. With all our modern medicine, is there a reliable fix for this stuff? Well, let's investigate one of the most common treatments out there. For a lot of people, a potential answer comes from the tip of a needle. Let's talk about something called an epidural steroid injection, or ESI for short. This is one of the most common things offered to people who are just desperate for relief from severe back and leg pain. So, what is an ESI? Well, the basic idea is pretty straightforward. You inject a powerful anti-inflammatory drug, a steroid, into what's called the epidural space. That's the little area that surrounds your spinal cord and all the nerves that branch out from it. The goal is to calm down the inflammation right at the source and hopefully relieve that awful pain that shoots down the leg, what doctors call radiculopathy. Now, here's where it gets interesting. Doctors don't just have one way of doing this. There are actually three main routes to get that medicine where it needs to go. They can go between the bones of the spine, that's the interlaminar approach, or they can go in from the side where the nerve comes out, that's the transforaminal approach. But the one we're going to focus on today is the third one, the caudal approach. So why zoom in on the caudal route? Well, it's pretty unique, and doctors choose it for some very specific reasons. Let's break down what it is and why it's even a thing. The caudal approach is all about the entry point. Instead of putting the needle right where the problem is in the low back, the doctor goes in through this small natural opening at the very bottom of your sacrum, basically right near your tailbone. Think of it like this. You're trying to fix some wiring on the third floor of a building, but you do it by going through the main electrical panel way down in the basement. It's a roundabout way to get there. So why on earth would you take this roundabout route? Well, for one, it's often seen as safer, especially for patients who've already had back surgery. That area is usually clear of scar tissue or metal hardware like screws and plates that might be blocking the other paths. And crucially, there's a lower risk of accidentally poking the dura, which is the sensitive sac around your spinal cord. That's a complication you really want to avoid. And this is super important, the caudal approach isn't just one single thing. It's done in two main ways. One is a high volume injection, where they use a whole bunch of fluid to literally push the medicine all the way up from the tailbone to the problem spot. The other is a much more advanced technique, sometimes called neuroplasty, where they actually thread a tiny catheter all the way up to the target. This lets them deliver the medicine with incredible precision. And believe me, this distinction is going to be critical in a minute. All right, so that brings us to the real heart of this explainer. Let's forget about what we think works or what we've heard works. What does the highest level of scientific evidence actually tell us? Let's dive into a major systematic review that tried to get a definitive answer. Our main source here is this 2022 systematic review. Now, a systematic review isn't just another study. It's like a study of studies. Researchers basically vacuum up all the good, high-quality research on a topic, put it all together, and try to find a final, conclusive answer. It's considered one of the absolute highest forms of medical evidence. And you can see just how tough the process is. They started with 364 potential studies. After they got rid of duplicates, screened them for quality, and made sure they were relevant, they were left with just 23. 23. This whole filtering process is designed to weed out any biased or weak evidence, so you're left with only the best of the best. So, to rate the evidence they were left with, the researchers used a system called GRADE. You can just think of it as a confidence score. High-quality evidence means we're pretty darn sure about the results. Moderate means we're reasonably confident. And low quality means, well, our confidence is limited and a new study could easily come along and change everything. A big reason this whole review was even necessary was because of this quote right here. There was a significant concern for bias. Turns out, a huge chunk of the existing studies on these injections were all published by the same main author. And in science, that can be a red flag. The community really needed a fresh, independent look at all the data. And this is probably the most stunning discovery they made. After all that work of filtering down to the 23 best studies, they found that only one of them, a trial by a researcher named Gerdsmeyer, actually reported success rates in a way that was valid and could be properly analyzed. Just think about that. The strongest conclusions of this entire massive review pretty much hang on that single well-done study. So, after all that, we're back to our big question. With the best possible evidence in our hands, does a caudal steroid injection actually work? It's time for the verdict.
Well, the answer isn't a simple yes or no. It turns out it really depends on how you do the injection and who you do it on. The review found moderate certainty evidence for only one very specific procedure, that catheter-based neuroplasty where the little tube is left in for 2 days, and only for patients who have either a disc herniation or pain that lingers after back surgery. For literally every other kind of caudal injection and for every other condition, the evidence was rated as low certainty.
But let's stick with that moderate evidence for a second. In the cases where that one specific technique was used, just how well did it work? 67%. That was the success rate. And that's a pretty remarkable number. This chart really puts it all into perspective, because this wasn't just some observational study. It was placebo-controlled. At the 6-month mark, the success rate in the neuroplasty group was 70%, and in the group that got a fake or sham procedure, only 9%. I mean, that is a huge, statistically significant difference that is pretty hard to argue with. Of course, knowing if something works is only half the battle. You have to ask, what about safety? Well, good news on that front. Across all 23 of those high-quality studies, the review found 0 reports of serious bad outcomes. Sure, there were minor, temporary things like some pain at the injection site and a few cases where the catheter didn't go in exactly the right place, but overall, the safety profile looked pretty good. This table, right here, this is really the whole story in a nutshell. It neatly sums up everything we just talked about, and you can see it clear as day. There is only one box with moderate quality evidence. It's for that very specific multi-day inpatient neuroplasty procedure for a couple of specific diagnoses. For everything else, and this includes the much more common single-shot injection you'd get as an outpatient, the evidence just isn't that strong yet. And that really leads us to the single most important takeaway from this whole thing. It seems like it's not just about getting the steroids into that epidural space. The how, the method of delivery, seems to be incredibly important, maybe more than we ever thought. The only technique that's backed up by moderate quality evidence isn't just a simple shot in the back. It's a more complex, more targeted procedure that you have to be in the hospital for. And this leaves us with one final, pretty provocative thought to chew on. This review really shines a spotlight on a massive gap in what we know. Does this mean most of the common back injections don't work? Or does it just mean they haven't been studied properly? So is the future of treating back pain about inventing brand new techniques? Or is it about finally doing the hard science to prove which of the treatments we already use are the ones that are truly effective? The evidence suggests we've still got a lot to learn.